Welcome, welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, everybody, that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 922681060. My dear friends, everybody at all the time is now knowing, who are seeing my videos continuously and giving the lots of comments. They are liking this series. Series is related with the patient complaints in the general medical practice. And when the patient tells particular symptoms, complaints, then how the doctor think, family physician, general practitioner, how he should think and how he can examine, how he can manage that particular patient in a very short manner. So today we have the case or the patient of 32-year-old male patient. 32-year-old male patient, middle-aged patient, okay? And he start complaining. Doctor, see, my hands are trembling since last 1 week. I'm afraid I don't know why I'm getting these tremors. Even sometimes, doctor, it is so problematic that I cannot write properly. I cannot sign, doctor. I even find it difficult sometimes to hold a cup of tea, and my family members, especially, see, my this wife is also worried about my this particular symptom. What is that? Is it very serious, doctor? Is it related with some brain? Relax, 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 Mr. Relax, my friend, relax. So doctor starts thinking whether these particular trembling is because of his alcohol. Is it he is taking a doctor don't know, but it may be alcoholic or simple anxiety tremors related with alcohol or simple anxiety related trembling. Okay. So doctor will start asking questions gently, and he will ask the patient to sit down and raise the arms horizontally with the relaxed fingers. And he will observe, he will keep the paper over here and he can observe the tremors, outstretched hand tremors. Can you see tremors? Doctor will check this. Then doctor will ask, is these tremors are associated with some tensions? For example, before giving any speech in your IT group, or talking to your boss, or any type of any competition type of this thing, then you get more type of this difficulty or the trembles. Yes, doctor, you are right. You are 100% correct. It is this particular my problem starts when I am having much more tension in my mind. Huh? See, the doctor has nearly coming to the conclusion, clinical provisional diagnosis, that these tremors are anxiety oriented. So the cause is anxiety. But still, doctor should check out all the other possibilities also. That's why these videos are there. Doctor will ask, tell me, my friend, be relaxed and be open-minded, nothing to be worried about. This is all confidential. Do you take the alcohol? Patient is shocked. Doctor, yes, I am sorry, but not regularly, doctor, only some occasionally. Very less time. Try to understand. Doctor is knowing that occasional drinking of alcohol does not produce withdrawal tremors. Occasional drinking alcohol does not produce withdrawal tremors. Alcohol-induced tremors are generally seen after a bout, and breath smell will be very clear that he has taken the alcohol, and that's why he has the tremors or the gait is lost. Now, the next question to the patient, okay. Now, Mr. Asi, tell me whether you are having any other health problem and are you taking any medicines? Nothing, doctor. I'm fine and fit. No problem with me. I'm absolutely normal. Doctor is asking because doctor is knowing that tremors can be the side effect of some medicines. For example, the salbutamol or the aspirin given for the asthma can cause tremors. Then imipramine or antidepressant or reserpine, these reserpine for hypertension. These these type of the medicines can cause drug induced tremors. So this is not the case with this patient. So I am relaxed. Okay. Now the next step of my examination, what the doctor should proceed for. The doctor should immediately check pulse rate. Pulse rate, normal pulse rate 72 per minute. If it is more than 100, that is called as a tachycardia. So the first and simple test, whenever the patient complains of tremors, always pulse rate is very important. Okay. If it is more than 100 per minute, which is called as a tachycardia, the most commonest cause of tachycardia is a tension, anxiety, or here, can you see? Thyrotoxicosis, thyroid problem, hyperthyroidism can cause tremors. Hyperthyroidism can cause tremors. But this patient has very tense and anxious look. So naturally, for this patient, anxiety is the most important cause. Doctor also can check, is there any smell of alcohol? But for this patient, no smell of alcohol, nothing. Okay. Then doctor will proceed to examine the neck in sitting position. Doctor will give some water to drink and ask to swallow that particular water. If goiter can be seen while drinking the water, palpate for, doctor will keep the hand here, thyroid thrill, palpation for thyroid thrill, and also he can check for the eyes X ophthalmos. All these are for the hyperthyroidism. Basal metabolic rate is increased, tremors is there, tachycardia is there, weight loss will be there, and patient is always complaining of heat, lot of heat, hot flushes in my body. Doctor, lot of heat. The person is so, what you can say, the temperature is high or the heat is there in the body, that even in the winter season, he will require the fan. In hyperthyroidism patient, in the winter season, by externally it is cold, the people are wanting for the warmer, and this hyperthyroidism patient wants the fan. Can you get the imagination? So this is a typical feature, excessive heat in the body. Okay. Then if these basic clinical examination findings are normal and tremors are atypical, that is, for example, tremor involving only one hand, right or left. If the tremors are coarse tremors, especially increasing in front of the people, then it can be hysterical tremors. Psychologically, there must be some tension and the patient is getting attack of hysteria. So here you can divert the patient's attention by talking or engaging her or the patient in some other test, and hysterical tremor will automatically reduce or disappear. So diverting the mind of the patient, if it is hysterical, they will go away, because hysterical people are always want to see that people get attracted towards him. People attraction is more important for the hysterical patient, because they want that they should be taken care of. Okay. So for the tremor patients, what are the important points? Number one is anxiety. Number two, alcohol, breath smell, then any medicine or drug induced tremors, thyrotoxicosis if weight loss is there. Weight loss is there, tachycardia is there, tremors are there, thyrotoxicosis. Then hysterical attack, it can be considered. In elderly patient, there are other two possibilities. If the patient is of above 50 plus, then you can think of senile tremors. Tremors because of the old age, or there may be Parkinson disease. So another video I have already prepared one separate video for Parkinsonism, but Parkinson is important cause for getting the tremors. Okay. So for these simple anxiety tremors, the symptomatic treatment, tablet propranolol tablet propranolol, tranquilizer, and most important is reassurance. Tell them that it is nothing to do with the brain. Don't get afraid. Don't get panic. By chance, if the patient is taking alcohol, then best way give the high doses of B complex, that is Bplex 4 tablet, and also can give the tranquilizer. If thyrotoxicosis your doctor is suspecting, better way patient should be asked to do the laboratory blood test for T3, T4 and TSH. In hyperthyroidism, T3, T4 levels will be high, but TSH level will be low. In hyperthyroidism, the doctor can prescribe neomercazole tablet, propranolol tablet, and also the tranquilizers. So this is all, my dear friend. Today we have discussed very interesting case of the tremors. I request all of you to like this video, share this video, and don't forget to subscribe my YouTube channel to boost Dr. Deshpande's energy. I wish you all the best. Take care and see you in the next video. Thank you very much. All the best.